This picture, like that is our ultimate fate, and these things come in. Some artists have drawn. Now, bones form the major part of the skeleton. You have seen the skeleton hanging in your dissection hall and also your demo room. Now you have 206 bones for the human skeleton. Some are small bones, some are long bones, some are flat bones. According to the region and according to the functions, the bones are there forming the human skeleton. The other day in the practical class I told you the evolution of erect posture. Now there are lots of controversies regarding Darwin's law that man has evolved from the apes. Whatever it is, the thing is that according to the build-up, if we think it in quadrupeds, then slowly with evolution, the skeleton also molded itself according to the need of the human body. Bones form the major part of the skeleton. Matrix is calcified by deposition of calcium and phosphate. Now the bone formation, the content of the bone is, the matrix is calcified by deposition of calcium and phosphates. Now these are two contents, like when you in health and diseases like osteoporosis, you will be hearing in a common, now it's due to the old age or a menopausal lady, there is some osteoporosis, due to some diseases, there is some osteoporosis. That is the thing, the matrix is calcified on deposition of calcium and phosphate. Then the content of the calcium and the phosphate alters according to the physiological aspect. Human skeleton consists of 206 bones of function. Bones give shape, support to the body and resist all forms of stress. Now I am walking, suddenly my skid or slip, then accordingly the bony skeleton and the muscles in synchrony, nervous system, everything, the brain is working together. They provide surface for the attachment of muscles, tendons and ligaments. Now we have you have read the humerus, attachment to muscles, tendons and ligaments. তোমাকে কেন বলছি, the skeleton as a whole. Now the muscle, say you are reading superior extremity. Now you will be reading the clavicle. Now this muscle will extend from anterior surface. Say the scapula, the serratus anterior muscles, the muscles will be from the scapula to the chest. Now if you think it in this component, you have to ratna hai, you have to bring it into memory. But if you can build up a concept, যে এটা এখান থেকে এখানে যাচ্ছে, আমার বাইসেপসটা এরকম আছে, এখানে বাইসেপসটা, এখান থেকে বাইসেপসটা এখান থেকে যাবে, এখানে ইনসার্শন হবে। নাও দি বাইসেপসের কি কি অ্যাকশন তুমি যখন আবার আমরা ডিসেকশন করাবো, তোমাদের পড়াবো, তখন তুমি বুঝতে পারবে, ঠিক আছে? এবার কাউরির বাইসেপস সালমান খান, ঋত্বিক রোশন and your Shahrukh Khan, whose biceps is big, bulky biceps. Card, Salman Khan, Hrithik Roshan or Shahrukh Khan? Bolo, hath tolo. ঠিক আছে? Just I'm saying that, see, I'm telling you the thing and myself. I didn't do gym and all, but I used to play games. I was a very naughty guy. Anyway, now bones give shape and support to the body and resist all forms of stress. They provide surface for the attachment of muscles and tendons. It protects vital organs of the body. Bones are 97% of the body's calcium and phosphorus. So 90%. Now in different diseases, if there is calcium depletion or something like this, or now if you go to Park Circus, Nihari is a dish prepared for breakfast. You go to Park Circus, have a nihari and some other items, parathas. So nihari is the bone marrow. But I am saying that bone marrow is helping in erythropoiesis. So now the bone marrow study, like you are having any erythropoietic problems of erythropoiesis, or so they study the bone marrow. You take a sternal puncture, or from the iliac crest, you take a puncture, put a smear and stain, and accordingly you see this is the bone marrow is involved in erythropoiesis. They serve as the livers for muscle action. I told you the muscle action is in the livers, the bones are there. এই যে জয়েন্টগুলো তৈরি হচ্ছে, না এই যে মুভমেন্টটা, the livers, okay? দেখবে আমার ঠান্ডা লেগেছে সেই দিন থেকে, একটু এই nasal sinuses, okay, they get inflamed and your intonation, your voice also changes. Oh, I have got a bad cold. So এটা কাজ করছে না রে। According to their position, according to their shape, according to the development, according to the gross structures, according to the microscopic structures, according to their position, the cranium, the mandible and the clavicle, this is the sternum, humerus, ribs and lumbar vertebra, the radius and ulna of your, you just read, you just correlate with your own body or your friend's body. This is the best you can learn in your this thing that now femur, patella, fibula, tibia and metatarsal and phalanges. Now the sternum, see the shape of the sternum here and see the shape of the sacrum. I told you that when you have attended my practical classes, I told you that you don't, you pick up the bone, the examiner says, you pick up a sternum and say it is sacrum. No, you see this is the sternum, this small as compared, the major part of the pelvis, the sternum, the sacrum forms the major component, 2 hip bones and 1 sacrum. That forms the pelvic. Now, axial is skull, vertebral column and thoracic cage. Now, skull, humerus, scapula, ribs, ulna, radius, pelvis, femur and tibia and fibula. According to shape, long bones, typical long bones, humerus, ulna, radius, femur and tibia and fibula. Typical long bones. You see the length. So, miniature long bones, your bones of the hand, the Now metacarpals, metatarsals and phalanges. Modified long bones, no medullary cavity. Now modified long bones, no medullary cavity, clavicle and body of the vertebra. Now the modified long bones, no medullary cavity, clavicle and body of the vertebra. These bones are small and generally cuboidal in shape. Example, carpal and tarsal bones. When you read this when we go to the hand, these small bones of the hand, the carpal and tarsal bones, the bones in the foot, the tarsal bones, the calcaneum, talus, navicular, cuboid. Now, flat bones, the bones resemble shallow plates and form boundaries of certain body cavities. Now, flat bones form some boundaries of the, say, the skull bones. This is a skull bone. Now, it is forming, and see, have you been to the burning ghat? Traditional burning ghat, Shashan ghat. You see the skull, they take a bamboo and thak kore mare. Tateo bhange na. That's why in Tarapit Mahashashan, still they have an electric chulli, but they are not, it is not being used. But when I was in class 8, I went to Tarapit just after my sacred thread ceremony, and there were femur, tibia, skull, all scattered in the Shashan. What I did, I had a small camera, click 3. Now, my friend, one of my best friends accompanied me. Then I told him to take a photograph. And I was bald after the sacred ceremony. I put the skull and I put 2 femurs and put the thing and put my hand on it. And this is the photograph I have taken in those days. When I was in class 8. So, but nowadays you cannot find, because the bones, whatever it is burnt, and if there are some skulls are there, it is being sold. And example, skull bones, ribs and sternum, scapula, flat bones. See the skull bone, when you see it is a flat, the ribs flat, okay, and sternum flat. The scapula, you see the scapula, your own scapula, it is a flat like this, a triangular bone. Irregular bone. The shape is irregular without any proper outline. Example, vertebra, hip bone, bones in the base of the skull. Now the shape is irregular without any, example, vertebra, hip bone, bone in the base of the skull. This is the hip bone. You see, it is a very irregular bone, and when we'll teach you the lower limb, we'll tell you to hold it in anatomical position, the shape, and also the surfaces. Now, this is the base of the skull. This is the base of the skull. These are 2 temporal bones. This is the sphenoid bone. This is the mandible. And you see from this, from the under surface, when you see the total skull, but when the base of the skull is, this is sliced off and sliced off, and the like it is like a bowl. Now, many these sadhu babas of the Tarapit Shashan or any Shashan, and you will see your ads, they Kamakha Khato, Tarapit Khato, এই অমুক শাস্ত্রী হোম যজ্ঞ করলো, সে আবার কি করে, এগুলো তো শোম্যানশিপ। হ্যাঁ, তো সে ওই স্কালের একটা বোল মানে কাট অফ, নাও দ্যাট বোল দে ড্রিঙ্ক অ্যালকোহল। এটা কি হচ্ছে, একটা অরা তৈরি করা, একটা পরিবেশ তৈরি করা। হ্যাঁ, সাধু বাবা মদ বোতলে খাচ্ছে না, আর সাধু বাবা দি স্কাল বলে ঢেলে মদ খায়। এটা তুমি যখন তুমি তোমার বন্ধুদের বলবে যে এরকম দেখলাম, বাপ রে বাপ কত খাচ্ছে, কিন্তু হয়তো সে একটু সিপ করছে, একটু সিপ করছে। হ্যাঁ, অ্যান্ড pneumatic bones, pneuma, that means some air spaces are there, and certain irregular bones contain large spaces lined by epithelium, and they decrease the weight of the skull and help in resonance of the voice and air conditioning chambers for the inspired air, maxilla, sphenoid, ethmoid, etc. When we have beautiful ethmoid bones, beautiful, but it's so delicate, so delicate. You have to handle with care to just see how the ethmoid looks. We'll show you, and see the maxilla. When you will by part we'll show you the sphenoid and ethmoid. This is the sphenoid. It has wings. When you teach, we'll go to head and neck. We'll now sesamoid bones. These bones develop within the tendon of some muscle. They don't possess periosteum and Haversian system. Sesamoid bones, the characteristic features is that they don't have an Haversian system and they don't possess periosteum, and they are within the tendon of the some muscle. They ossify after birth. They minimize the friction and also change the direction of the pull of the muscle. Example, patella and pisiform. So, pisiform, if a short notes of 4 marks comes or 3 marks, that what are sesamoid bone? Then you give the description, just the 4 lines. The example is patella and pisiform in the hand. Now you see, now this is the quadriceps muscles at rest, and the quadriceps muscles contract, and patellar tendon is here, patella is here, kneecap, the tibia and shin bone. It is very prone to fractures. So there are 2 modes. There is some, depending on the fragments, কটা টুকরো হচ্ছে, depending on the fragment, you have to decide. You will wire, or just a simple, you put a wire, or you excise. So this is the thing, and pisiform, this is the pisiform. Now this is a membranous bone, this is a fetal skull. They ossify in membranes. Example, bones of the vault of the skull and facial bones. And cartilaginous bones, they ossify in cartilage. Bones of limbs, vertebral column and thoracic cage. They ossify partly in membrane, partly in cartilage. These, the clavicle, mandible, the occipital, sphenoid and the temporal. Now, ossify partly in membrane, partly in cartilage. The clavicle, mandible, occipital, temporal and the sphenoid. This is the shape of the clavicle, this is the clavicle, this is the mandible, this is the occipital, this is the temporal and this is the sphenoid. Compact bone and spongy cancellous bone. You see the lacuna containing osteocytes, lamella, cannuliculi, osteons are there, the bone and trabecular spongy bone, osteon of the Haversian canal, Walkman's canal and periosteum. This is the periosteum. Compact bone. Structurally, it is made up of bony plates which are arranged compactly. Outer cortical part of long bone. Spongy bone, cancellous. Structurally, it is made up of bony plates which are arranged in irregular living spaces in between them. When you see a cross section in your textbook or your atlas, you will see the bones. The best picture, you see it in Gray's anatomy. Astrology-te সবই গ্রে তো লাস্ট ওয়ার্ড আছে, হ্যাঁ। তো কিন্তু তোমরা যে বইগুলো পড়ছো সেগুলোও ঠিক আছে, কিন্তু একটা করে অ্যাটলাস, আমি থাইমে অ্যাটলাস বলেছি। এবার যে যেটা কিনেছো সেটা তার কিনেছো, কিছুই ডিফারেন্স সেরকম নেই। একটা প্রেজেন্টেশন, how you present, okay. Now structurally it is made of bony plates. It gives a spongy appearance. It's a flat bones, irregular bones and ends of long bones. According to microscopic structures, lamellar bone, fibrous bone, they found in young fetal bones but are common in reptiles and amphibia. Reptiles, সর্প, সাপ, ঠিক আছে, আর অ্যাম্পিবিয়া মোস্ট কমন ইজ ফ্রগ, তাই তো। Dentine and cement present in teeth. Okay. Parts of young bones. A typical long bone ossifies in 3 parts. The 2 ends ossify from secondary center and intervening shaft from primary center. Now, ossification, actually, we try to neglect. Examination, পরীক্ষায় আবার ওই 3 নম্বর 4 নম্বর, what is ossification? And you mention the ossification centers of long bones, say femur or tibia বলে দিল। এবার সেখানে তোমার এইগুলো দেখতে হবে, you have to see this, okay. Now this is the epiphysis, epiphyseal plate or cartilage. This is the diaphysis, this is the metaphysis. Epiphysis, epiphyseal plate, diaphysis and metaphysis. Epiphyseal plate of cartilage, epiphysis, the end and tips of the bones which ossify from secondary centers. Diaphysis, it is the elongated shaft of the long bone. This is the elongated shaft which ossifies from primary center. Metaphysis. The ends of the diaphysis are called metaphysis. तो diaphysis is duto end. That is known as metaphysis. Each metaphysis is a zone of active growth. Before epiphyseal fusion, the metaphysis is richly supplied with blood through the end arteries. After the epiphyseal fusion, vascular communication is established between the metaphyseal and epiphyseal arteries. Epiphyseal plate of cartilage, it separates epiphysis from metaphysis. You see the cartilage separating from the epiphysis and the metaphysis. So the part is, for proliferation of cells in this cartilage plate is responsible for lengthwise growth of a long bone. After the epiphyseal fusion, the bone can no longer grow in length. Gross structure of adult long bones, naked eye examination of LS and TS of bone showing the following. Now, shaft composed of periosteum, cortex and medullary cavity. When you will be dissecting the dead body, the lower limbs or the upper limbs, you separate the muscles and expose the bone, and you will see a thin membrane like that is the periosteum. Now that periosteum has a rich vascular supply, also nerve supply. Through the vessels, the nerves travel. So minute. So one thing I tell you, say any injuries of the hand, you have to be very careful. Injuries of the hand is that the see the your now why I am saying that at a fracture হয়েছে হ্যান্ডের একটা এবার এই আর্টারি সাপ্লাইটা নাও এনি ইনজুরিজ অফ দি হ্যান্ড এটা কেটে গেছে তারপরে একটু ফ্র্যাকচার হয়ে গেছে এগুলো আন্ডার লোকাল অ্যানেস্থেসিয়া by 2% xylocaine. You block the nerve in the web spaces, and even you can excise small tumors even. এর জন্য অ্যানেস্থেসিস লাগবে না, জেনারেল অ্যানেস্থেসিয়া ঘুম পাড়িয়ে দিলে দরকার নেই। So the anatomy is such a thing that you have to learn. Now why I'm saying the hand is so precious, you can save একটা জায়গায় একটার দিকে কেটে গেছে ঠিক আছে, বাট এ তো ক্রস সার্কুলেশনে তো এটা মানে নেটওয়ার্ক। ন্যাচুরালি ইফ ওয়ান ভেসেল গেটস ইনজার্ড then it can be by their bypasses, they will definitely supply the one thing, any hand injury. Now one is that you manage bleeding first. You see where it is coming from, the bleed, and if any tendon injury is there or not. এবার how much you can save আছে বলে দিলে কেটে দিতে হবে এই দিতে হবে, নো, you have to try to preserve, কারণ আমাদের দেশে হ্যান্ড সার্জনস এখনো সেইভাবে তৈরি হয়নি। এই যে ফাইন হেয়ার লাইক সুচার্স 40, 30, 60 fine silk sutures or your chlorine sutures. Now, if there is a cut injury of this tendon, then you have to position in relaxed position, glass holding position. These are the conditions where it won't be like stretched or overstretched or cocked up, but you give a support at least. Suture the apparently the sputters which is coming under local anesthesia, you can manage many injuries. কিন্তু ভাই ভাই সেলাই দিয়ে দাও, আমি যখন এমার্জেন্সি ডিউটি করছি তখন আমরা কি করি, ওই যারা ইমার্জেন্সিতে যারা আছে তারা এক্সপার্ট, ঠিক আছে, কিন্তু তুমি তোমার ট্রেনিং পিরিয়ডে 3 মাস সার্জারি করবে, তো তুমি শিখবে, তুমি করবে, তুমি নেবে, তোমাকে কেউ আটকাবে না। The more you handle, the more you do, and you apply your knowledge. He is skilled, but many things you are in point advantage. তোমার নলেজ তুমি ইয়ে করবে। You understand what I am trying to say? এক ভদ্রমহিলা কি একটা গ্লাস জারে বোধহয় হাত ঢোকাতে গেছিল, তার এই টেন্ডন গুলো, 2টো টেন্ডন কেটে গেছিল, তো আমার কাছে নিয়ে এলো ব্লিড ড্রেসিং খুললাম। এবার কি হচ্ছে, ব্লাড প্রেশার কাফ লাগিয়ে দিলাম, পাম্প করলাম, 160-80-তে ফিক্স করে দিলাম, তাহলে এটা ব্লকেড হয়ে গেল, ব্রেকিল আর্টারিটা ব্লকেড হয়ে গেল। এবার কি হচ্ছে, টুর্নিকেটের কাজ করলাম, টুর্নিকেট নাও, তাহলে আমার দেখে নিলাম, ফিল্ডটাকে পরিষ্কার করলাম, তার আগে লোকাল জাইলোকিন লিডোকিন ব্লক করলাম, দিয়ে সেটাকে দেখে এবার বললাম, একজনকে বললাম ছাড়ো, সে ছাড়ছে, তখন দেখছি ব্লিডটা হচ্ছে কোথায়, it might be a sputter, it might be a diffuse contusion injury, so there will be some diffuse bleeding, so you have to apply the tourniquet. Don't panic. ও আমি তো অপথ্যালমোলজি করব, আমি তো স্কিন করব, ডার্মাটোলজি, আমি তো ইয়ে কি বলে রেডিও ডায়াগনোসিস করব। হ্যাঁ, একটা রেডিও ডায়াগনোসিসের সিট বিক্রি হয়েছে 7 crores, ঠিক আছে। তো আমি কি বলতে চাইছি সেটা হচ্ছে, তুমি তোমার অ্যানাটমিটা পড়ো ভালো করে, কোথায়, হ্যাঁ, নাও periosteum, fibrous membrane covering the surface of the bone. তোমার ডেড বডিতে, তোমার ডেড বডি নয়, তোমার ডিসেকশন হলে যে ডেড বডিটা থাকবে, তোমরা একটু একটা স্ক্যালপেল দিয়ে একটা মাসলগুলোকে একটু সরিয়ে একটু দেখে নেবে যে হাউ দি পেরিওস্টিয়াম লুকস। Look, see, ঠিক একটা ট্রান্সপ্যারেন্ট যে ট্রেসিং পেপার গুলো হয়, হ্যাঁ, তার থেকেও মানে মাইক্রোনতে অনেক পাতলা, তো তুমি দেখে নেবে যে এটা, যদি বলেন স্যার এত তো দরকার হয় না, কিছুই দরকার হয় না। একজন বোলপুরের এই পাশে তার 100টা পেশেন্ট হয় ভদ্রলোকের, সে একজন পণ্ডিত ডাক্তারের কাছে বর্ধমানে সে পাশে ছিল, সে শিখেছে, তার কিন্তু 100টা পেশেন্ট হয়। আবার জন হান্টার, হি একটা ছবি আছে ডিসেকশন হলে ওই দিকে একবারে ইস্ট এন্ডে, এটা মোটামুটি 3 ফুট বাই 2.5 ফুট বোধ হয়, আমার মনে নেই, ছবিটা দেখে নেবে। কেন জন হান্টারের কথা বলছি, কারণ জন হান্টার অ্যাকচুয়ালি জন হান্টার ব্রাদার, এল্ডার ব্রাদার, John Hunter's elder brother was a renowned doctor of those days. He used to teach anatomy, and he used to teach in his house. He had collected specimens like Somar Mitra sir, Calcutta Medical College. উনি স্পেসিমেন দিয়ে টিউশন দিতেন, ঠিক আছে। Similarly, John Hunter was such a guy that he was a school dropout. ওই তোমার স্টিভ জবসের মতো, তারপরে মদ খেত, প্রস্টিটিউশনদের কাছে যেত, কিন্তু ওয়ান সামার জন হান্টার thought that I don't want to live this life. So he wrote a letter to his brother that you please give me a chance to work in your laboratory to help the students to take out specimen. যেটা আমার মল্লিক ভাই মনু সোনুরা করছে, হ্যাঁ, তো একটা টেকনিক্যাল অ্যাসিস্ট্যান্ট হিসেবে। বাট জন হান্টার, what he did, he studied, looked into things, and till date, he is such a personality that Europe has not produced a surgeon of his caliber. What Europe? It's the world, I would say. He had written 13 or 12 books with his own illustrations, and when you do the inguinal canal dissection, it's the Hunter's canal. There are numerous features there, but one of his, কি বলবো, শালা বাবু, he was jealous of John Hunter. ওর প্রায় 8-10টা বই পুড়িয়ে দিয়েছে। আবার যদি আমরা আয়ুর্বেদে চলে আসি, your সুশ্রুত, চারাক, these people, এই বুকগুলো প্রিজার্ভ থেকে গেছে, স্ক্রিপচারে থেকে গেছে, তার জন্যই আমরা আছে, we are enriched with Ayurveda, we are knowing things. এটা যদি তখন পুড়িয়ে দিত, মোহাম্মদ বিন তুগলাক এরা যদি পুড়িয়ে দিত, তাহলে কিন্তু আমরা আয়ুর্বেদের চর্চাতে যেতে পারতাম না। এখন এইমস তোমার এই মেডিটেশন, পূজা পাঠ, এর উপরে এখন রিসার্চ চলছে, আয়ুর্বেদের উপর রিসার্চ চলছে। দি আয়ুর্বেদিক সার্জারি is they to do intracranial tumor operations. So you have to know the anatomy, and why I'm telling you why it is nothing impossible. তুমি যেটুকু পিরিয়ড 8 মাসে যেটুকু শিখবে শিখে নাও, you can come back again, come back. And outer surface layer, inner cellular layer, which is osteogenic in nature, কর্টেক্সটা এত শক্ত, তুমি গিয়ে দেখবে আমাদের বোনসে, তোমার কাছেও কিনেছো তোমরা, you have purchased. Now what I want to say is that, but yet where মানে একটা স্ট্রেস ইনজুরির তো একটা লিমিট থাকবে। ধরো ওর পেছন থেকে তুমি চুলটা টানছো, হ্যাঁ, এবার চুলটা টানছো, ও কিছু বলছে না, তারপরে ঘুরে একটা থাপ্পড় দিয়ে দিল। হ্যাঁ, সিমিলারলি এই যে মানে একটা এত RTA, road traffic accident is in the rise because of your vehicles. Now you have to encounter all types of injuries. তুমি, আমি অর্থোপেডিক্স নই, আমি ফিজিশিয়ান নই, তুমি একটা বেলগড়িয়া তে বসে একটা চেম্বার চালাচ্ছ, তখন একজনকে নিয়ে এলো, তোমাকে তো কিছু সাপোর্ট দিয়ে তুমি পটাবে। তো তুমি একটা কিছুই পেলে না, একটা কার্ডবোর্ড দিয়ে স্প্লিট করে দিলে, এটা দেখছো যে না এটা অর্থোপেডিক্সে যেতে হবে, আপনি হসপিটালে যান, স্পেশালিস্টে যান। তো ইফ ইউ গিভ আ সাপোর্ট দ্যাট হেল্পস। এবার বোনের ইঞ্জুরি কোন ফোর্সে গেলে তুমি দেখবে একটা ফিমারটাকে নিয়ে তুমি দেখো না আজকে ক্লাসে গিয়ে এমনি করে মটকাতে, একটা হিউমারাসকে মটকাতে পারো কিনা, পারবে না। তো এই যে কম্প্যাক্টনেস আছে তাতে যে ফিজিওলজিক্যাল রিয়াকশনস গুলো হচ্ছে, ক্যালসিয়াম ডিপোজিশন, ফসফেট ডিপোজিশন। Now medullary cavity is filled with red or yellow bone. Of long bones are made up of cancerous bone covered with hyaline cartilage. Now this red, the bone, when you go to mutton shop you can see, you see chicken sometimes ঠিক বয়েল হয় না, রান্না হয় না ঠিক মতন, তারপর যখন মুরগির ঠ্যাংটা চিরোতে আছে তখন রেড লাগছে, হ্যাঁ, তখন তো মানে ইউ না এই ওয়েটারকে ডাকলে কি হচ্ছে, এটা কি চিকেন দিয়েছো। তো ওই যে রেড পাল্পের যে জায়গাটা আছে। এবার কথা হচ্ছে 1716 or something like that, I cannot recall, pork was served in one restaurant, and the person with his friends, I cannot recollect his name, I'll tell you the next day, that this pork, the taken from the pigs, now they were fed on some diet, that gives a red stain to the bone, inner. So when they were served, he told, and the doctor among them was an anatomist, and he later on, after seeing the meal, the pork dish, they actually he decided that he will present a paper, and he published in one of the journals on those days, 1700 something, that he presented this paper. Later on, he continued research on feeding this pork, your hens and chickens or whatever it is, and they got this result. But that does not say that the red pulp, আমার মনে এখন আমি তো সবই খাই, কিন্তু এখন আমার বোন থেকে তোমার বোন থেকেও পাবো না আমরা ওটা, ওটার স্পেসিফিক ডাই ছিল, কেন বিটরুট যেমন খেলে সেই রকম একটা ডাই, তো তার তোমার ইয়েটাও সেরকম হবে। নাও Now actually the arterial supply of the long bones. Now one thing I tell you, if you go to, you see graze the Habertsen system and the arterial supply of the bones. You just see, and with your phone you take, if you don't buy up, not having a graze anatomy, you take a beautiful color pictures are there. Black and white mostly, even the your sections, your longitudinal section, transverse section, sagittal section. Now these sections, you can see the bones, they have taken the section. You can just photograph them, beautiful. You just one up and then you make it, share it. You will see the uniqueness of the bone and how it exactly looks. যেটা বলেছিলাম যে what the mind doesn't know, the eyes cannot see. তুমি যত দেখবে, যত ইয়ে করবে, আটকাবে না। সেটা সব জীবনের সব, যত কবিতা লিখবে, ছড়া লিখবে, হ্যাঁ, গান লিখবে, তো সেটা তোমার কন্টেন্ট তৈরি হবে। And don't be only একটা পড়াশোনা করবে, don't. You explore the facts of life and life, enjoy everything. এই দুর্গা পুজো কদিন মাথায় আনবেই না, এই 5 দিন একবারে বিন্দাস, ফ্রেন্ডস, প্যারেন্টস, এভরিথিং, এটাও টাইম স্লট থাকবে। Our will meet, and today I don't know what duty is assigned to me.
Community medicine, you have to think about the whole community, whole society, whole town, whole village, whole state, whole country, etc., like that, or whole world, you can say. So these are the differences in general. Just clinical medicine focuses, it treats individual. They mainly treat, and they also, I mean, this discipline does not give that much of importance. Yes, they are giving importance to prevention also, but they also mainly treats. When individual or any person becomes ill, they go to the clinical medicine specialist or like that. But community medicine treats the whole community. I told you the group of people having some characteristics are called community. A community may be different types. Suppose this Mbbs may be a community, or there you may call it a student community. You may be called as an undergraduate student community, different types, or you may be called the community of Shantiniketan Medical College first year or like that, or this Mulug or Govindapur may be a community. It may be religion wise also, Hindu community, communist, Muslim community, Christian community, Buddhist community. It may be the whole Bolpur subdivision may be a community, the whole Birbhum district may be a community, like that. So it treats, I mean, or its focus, I mean, its focus is mainly on the community. Second concern is clinical medicine concern is about sick persons who become sick for health, and community medicine, healthy people and sick persons of the whole people. Not only community medicine does not focus only sick persons, but also healthy people. Healthy means apparently healthy. I told you. The last class I told you. You see the angry young man Amitabh Bachchan is healthy. He may not be healthy 100%, because community medicine wants the ideal definition. They one person or the whole community become healthy physically, mentally, socially, and nowadays some call also spiritually. Okay, so that may be total healthy. So healthy means here not actually healthy, apparently healthy. Clinically, I think you are healthy. Today you are not suffering from any disease. Okay, so community medicine treats all those things. Goal, the clinical medicine goal is to relieve symptoms, signs, and cure the patient. The signs and symptoms to be relieved. You are suffering from fever, you are suffering from some cardiovascular disease, you are suffering from diarrhea and other things. So you want to get rid of the symptoms and cure. But the goal of community medicine is to prevent, to eliminate and eradicate disease in the community. We will discuss what do you mean by control, what is elimination, what is eradication, we are coming in next. So it is the goal of the community medicine. So I told you that actually most of the developing countries, we are not giving that much of importance to the community medicine, but only, I mean, community medicine can prevent, eradicate and eliminate diseases from the community. Okay, most of the diseases, as nowadays proved that. Skills and competence. What the skills and competence, where someone become community medicine specialist, some become clinical medicine, some maybe surgeon specialist. Skills and competence, clinical medicine only clinical skills. Do you understand what is clinical skill? What is clinical skill? It is often said that Bidhan Rai was the greatest physician because his clinical skills were, clinical skills, what you see by symptoms, his voice, his feelings, and asking all this clinically. That is, suppose I see here the color of the, it is called lower parietal conjunctiva, or I see the color of the nails, or I see the color of the tongue. I can say clinically he or she is suffering from anemia. These are the clinical skills. That is called clinical skills. That is the sign and symptoms suffering by individuals when a doctor clinically. So if you want clinically best, you will be the best physician. Nowadays, students, they in our time, most of the time we used to make adda in emergency medicines. So we have seen lots of patients, lots. I am from medical college, so you know in medical colleges, corridors and etc. and all these things. I have done obstetrics and gynecology house staffship. We used to, I mean, in one bed, 2 mothers are there because bed scarcity. Most of the government medical colleges are like that. We used to bring them all these things because we always see patients. If you see patients as much as possible, your clinical skill will develop. You will be the best physician. Nowadays, people become gadget oriented, but still clinical medicine is important. People go to the gadgets, yes, blood, go to the lab, or lung function test, liver function test, everything. And according to that, people are making diagnosis. That is not, he is not an ideal doctor. Ideal doctor, ideal clinical, if your clinical skills becomes much, much more. That is putting stethoscopes here with hammers, or seeing data, or feeling, or hearing, or listening, you can understand all those things. Okay? I am bringing you one examples. One of the best physicians of our teacher is Dr. Sheetal Ghosh, who I don't know, who are from Howrah area. Your fathers and mothers maybe know. He was very